Are you considering taking decongestants to relieve your stuffy nose? Before making a decision, it's important to understand the potential side effects of pseudoephedrine, a common ingredient found in many over-the-counter nasal decongestants. In this video, we will reveal the truth about the potential risks associated with pseudoephedrine and what you need to know before taking these medications. What is pseudoephedrine? Pseudoephedrine is a sympathomimetic drug that works by narrowing the blood vessels in your nasal passages, reducing congestion and allowing you to breathe more easily. It belongs to a class of medications known as decongestants and is commonly used to relieve symptoms associated with colds, allergies, and sinus congestion. Pseudoephedrine is available in various forms, including tablets, capsules, and liquids. Pseudoephedrine is a widely used decongestant because of its effectiveness in providing relief from nasal congestion. However, it's important to note that it is not a cure for the underlying condition causing the congestion. Instead, it provides temporary relief from the symptoms, allowing individuals to breathe more easily. Common uses of pseudoephedrine. Pseudoephedrine is commonly used to alleviate symptoms associated with nasal congestion caused by allergies, colds, and sinus infections. It works by constricting the blood vessels in the nasal passages, reducing swelling and congestion. This allows air to flow more freely, providing relief from a stuffy nose and making breathing easier. In addition to nasal congestion, pseudoephedrine may also be used to relieve pressure and pain in the sinus cavities caused by sinusitis. Sinusitis is an inflammation of the sinus lining that can lead to symptoms such as facial pain, headache, and congestion. Pseudoephedrine can help alleviate these symptoms by reducing inflammation and improving drainage. It's important to note that pseudoephedrine should only be used for short-term relief of symptoms. Prolonged use can lead to a condition known as rebound congestion, where the nasal passages become even more congested and inflamed. If symptoms persist or worsen, it's advisable to consult a healthcare professional for further evaluation and treatment options. Side effects of pseudoephedrine. While pseudoephedrine can be effective in providing relief from nasal congestion, it's not without its drawbacks. Like any medication, it can cause side effects, some of which can be serious. It's important to be aware of these side effects before taking pseudoephedrine to make an informed decision about its use. One of the common side effects of pseudoephedrine is an increased heart rate. Pseudoephedrine is a sympathomimetic drug, meaning it stimulates the sympathetic nervous system. This can lead to an increase in heart rate, which can be concerning for individuals with underlying heart conditions or high blood pressure. Elevated blood pressure is another potential side effect of pseudoephedrine. The drug can cause blood vessels to constrict, resulting in increased blood pressure. This can be problematic for individuals with hypertension or other cardiovascular conditions. It's important to monitor blood pressure while taking pseudoephedrine and consult a healthcare professional if there are any concerns. In addition to cardiovascular side effects, pseudoephedrine can also cause insomnia and nervousness. These side effects are more common with higher doses or prolonged use of the medication. Insomnia can be particularly troublesome as it can lead to fatigue and impaired cognitive function. It's important to take pseudoephedrine earlier in the day to minimize the risk of sleep disturbances. Allergic reactions to pseudoephedrine. While rare, allergic reactions to pseudoephedrine can occur. Symptoms of an allergic reaction may include hives, rash, itching, swelling of the face or throat, difficulty breathing, and dizziness. If any of these symptoms occur after taking pseudoephedrine, it's important to seek immediate medical attention. Individuals with a known allergy to pseudoephedrine or other sympathomimetic drugs should avoid taking medications containing pseudoephedrine. It's crucial to carefully read the labels of over-the-counter medications to ensure they do not contain pseudoephedrine or any other ingredients that may cause an allergic reaction. Interactions with other medications. Pseudoephedrine can interact with certain medications, potentially causing adverse effects or reducing the effectiveness of other drugs. It's important to inform your healthcare professional about all medications you are taking, including prescription, over-the-counter, and herbal supplements, before starting pseudoephedrine. One notable interaction is with monoamine oxidase inhibitors, MAOIs, a class of antidepressant medications. Combining pseudoephedrine with MAOIs can lead to a dangerous increase in blood pressure, which can have serious consequences. It's essential to avoid taking pseudoephedrine if you are currently taking or have recently taken MAOIs. Other medications, such as beta blockers and some antidepressants, may also interact with pseudoephedrine, leading to increased blood pressure or other adverse effects. It's crucial to consult a healthcare professional or pharmacist before taking pseudoephedrine if you are taking any other medications. Precautions and warnings when taking pseudoephedrine. Before taking pseudoephedrine, it's important to consider certain precautions and warnings to ensure its safe and effective use. These precautions include medical conditions. Individuals with underlying medical conditions, such as cardiovascular disease, hypertension, diabetes, hyperthyroidism, or prostate enlargement, should exercise caution when taking pseudoephedrine. It's important to consult a healthcare professional to determine if pseudoephedrine is safe for use in these situations. Pregnancy and breastfeeding. Pseudoephedrine should be used with caution during pregnancy and breastfeeding. The drug can pass into breast milk and may have adverse effects on the baby. It's important to consult a healthcare professional before using pseudoephedrine if you are pregnant or breastfeeding. Age restrictions. Pseudoephedrine is generally not recommended for children under the age of 4 years. For children aged 4 to 11 years, the use of pseudoephedrine should be supervised by a healthcare professional. It's important to follow the recommended dosages and guidelines for pediatric use. Driving and operating machinery. Pseudoephedrine can cause dizziness, nervousness, and impaired cognitive function. It's important to be aware of these potential side effects and avoid driving or operating machinery if you experience them. How to minimize side effects of pseudoephedrine. While pseudoephedrine can cause side effects, there are steps you can take to minimize their occurrence or severity. These include: stay hydrated. Drinking plenty of fluids can help alleviate some of the drying effects of pseudoephedrine, such as a dry mouth or throat. Staying hydrated can also help thin mucus and promote drainage. Avoid excessive caffeine. Pseudoephedrine can increase heart rate and blood pressure, and combining it with excessive caffeine intake can exacerbate these effects. It's important to limit caffeine consumption while taking pseudoephedrine. Take the lowest effective dose. Start with the lowest effective dose of pseudoephedrine and only increase if necessary. Taking higher doses increases the risk of side effects. Avoid prolonged use. Pseudoephedrine should only be used for short-term relief of symptoms. Prolonged use can lead to rebound congestion and other adverse effects. Natural alternatives to pseudoephedrine. If you prefer to avoid medications or are looking for natural alternatives to relieve nasal congestion, there are several options to consider. These include saline nasal irrigation. Using a saline solution to rinse the nasal passages can help remove excess mucus and reduce congestion. Saline nasal sprays or neti pots are available over the counter and can provide relief without the potential side effects of medications. Steam inhalation. Inhaling steam from a hot shower or a bowl of hot water can help moisturize the nasal passages and alleviate congestion. Adding a few drops of eucalyptus or peppermint oil to the water can provide additional relief. Hydration and rest. Drinking plenty of fluids and getting adequate rest can help support your immune system and alleviate symptoms associated with nasal congestion. Herbal remedies. Some herbal remedies, such as eucalyptus, peppermint, and ginger, may have decongestant properties. It's important to consult a healthcare professional or herbalist before using herbal remedies to ensure their safety and effectiveness. Consultation with a healthcare professional. Before starting any medication, including those containing pseudoephedrine, it's important to consult a healthcare professional. They can evaluate your medical history, assess potential risks and interactions, and provide personalized advice based on your specific needs. A healthcare professional can also help determine if pseudoephedrine is the most appropriate treatment option for your nasal congestion. They may recommend alternative medications or non-pharmacological interventions based on the underlying cause of your symptoms. Remember, self-medication without professional guidance can be risky, especially when it comes to medications with potential side effects like pseudoephedrine. Your healthcare professional is there to help you make informed decisions about your health and well-being. Conclusion. Pseudoephedrine is a commonly used decongestant that can provide relief from nasal congestion. However, it's important to be aware of the potential side effects and risks associated with its use. It can cause increased heart rate, elevated blood pressure, insomnia, and nervousness. Pseudoephedrine may also interact with certain medications and medical conditions, making it crucial to consult a healthcare professional before use. While pseudoephedrine can be an effective short-term solution, it's important to prioritize your health and safety. Consider natural alternatives, such as saline nasal irrigation and steam inhalation, and consult a healthcare professional for personalized advice. With the right information and guidance, you can make an informed decision about whether pseudoephedrine is the right choice for your congestion relief needs.